Hello, friends, welcome back to my channel. So, today I have made a video on a very important topic, which is tumors of the oral cavity. It's very important from any exam point of view. You're going to get few questions on this basis. So, I'll be taking you through the tumors, their important features, and especially with what type of questions they are asked in ORE part 1. Okay, and I will also let you know how to reach to the diagnosis and how to answer those questions step by step. Okay, so stay tuned till the end and let's get started. The first tumor which we'll be talking about today is osteosarcoma. So let's revise a bit of it. So it's a malignant tumor which affects the bone, you know that. And if you look at the clinical features, it's a rapidly growing mass with radius and ill-defined, accompanied with pain. It affects maxilla, but more common in mandible. Paresthesia is there. So these are the few features which you should know. But if you look at the picture here, so what do you see? There is a bony growth, which is massive, okay, and you may be given an X-ray, which is showing again quite destructive lesion, okay. So in the clinical history, how will the exam question come? So exam question may give you in the exam you may get these pictures, one of the clinical picture, and you may be asked along with little bit of history. So if we talk, the patient comes to you and you don't know it's osteosarcoma, but the patient comes to you and uh, and presents with a rapidly growing mass in any of the regions, in some of the premolars, lower premolars, say mandibular, okay, and patient is having pain and having a bit of numbness, and what do you think it is? Okay, and you're given this kind of picture. Then pain and numbness are the two things which are not seen in benign things. It is associated with the malignant tumors. So you should directly think of something malignant among the options, and that will be osteosarcoma. Okay. So you can rule out the other ones from the given history and then you can reach up to the diagnosis. So one is this clinical scenario based question. Another one is you may maybe ask the direct question like, what is the radiograph is showing this particular type of appearance, what do you think it is? Okay, so these are the types of questions that you should expect in the exam regarding this type of tumor. Okay, next tumor which we'll be talking about is squamous cell carcinoma. It's again one of the most common malignant tumors of the oral cavity. So how does it present yourself? The patient will be coming to you and will be presenting to you as an ulcer, okay, erosion, or there is ulcer. Okay, if you're given only a picture, then you will have to again see what sort of ulcer is it, what is the site. Okay, you have to start thinking from that end. Okay, if you look at the picture, look at the borders of the ulcer. Ulcers is a different, I can make a whole of video on ulcer. If you want me to make one, just leave a comment in the comment box, I'll make one. But if we talk about the squamous cell carcinoma, it presents as an ulcer. Okay, then comes the site, which is very important again. So the site of the so the site for squamous cell carcinoma is lateral border of the tongue, ventral surface of the tongue, and the lips. Okay, these are most commonly affected sites. And because tongue is highly vascular organ, so it has very high lymphatic drainage. So as in any other malignancy, there will be fixed and firm lymph nodes. Okay, so the type of question which may come here is from the clinical picture again. Okay, or direct question may come, which is the important site here, or what sort of lymph nodes will be there. So any of these kind of questions may come regarding squamous cell carcinoma. Next thing which we'll be talking about is condensing osteitis or focal sclerosing osteomyelitis. I know it's not tumor, but it's important to mention here because it is most commonly confused with cementoblastoma, which is again a type of benign tumor of cementum. So what is one is familiarize yourself with all the types of names of the tumors. Okay, you should definitely know the common ones, but just familiarize yourself. Do give it a read to other names as well. Okay, they may trick you like that. And condensing osteitis, itis, so it shows that it is inflammatory disease. It's the periapical inflammatory disease which results from reaction to the dental related infection. Okay, why it happens is because there is inflammation, so that triggers the body to produce more of the bone in that particular area. All right, you can see it in the arrow in the picture here. The arrow is showing it. Okay, but the difference between cementoblastoma, even in cementoblastoma also, there will be a big lesion, radiopaque lesion, which is associated here. I can show you if you can see it here. Okay, in the picture below. So yes, here. But in in the inflammatory thing, there will be a large tooth cavity, but it will not be same in cementoblastoma. That is the distinguishing feature. So you have to keep that in mind. Okay, and let's now talk about odontomas. Odontomas are another type of tumors. Okay, so it may be compound, it may be complex. I'll be discussing both of them here. So compound. So in this type of for this topic, they can give you an X-ray. Can you see the X-ray here? So they are showing you the teeth with the roots, and there are few white dots there. Okay, radiopaque mass is seen. So if that radiopaque mass is resembling any of the tooth structure, okay, then it is compound odontoma. But if it is doesn't resemble any of the teeth forming structures, then it is complex odontoma. These are the two differences in this. Okay. Moreover, in odontoma, compound odontoma, it is most commonly found in the anterior area. That's another important thing to remember. So question may again come uh, as a direct question, okay, or they may give you a radiograph and you may have to distinguish between these two odontomas. Okay, this is the complex one. There is no resemblance to any tooth structure. All right. Next one is melanotic neuroectodermal tumor. So as the name suggests, melanotic means there will be some pigmentation. So in the clinical picture, you should look for some of the blue, red areas of pigmentation, or in the history which they are given in the question. And the neuroectodermal means there it is related to neuroectodermal tissue. Tumor is there. It's normally seen in the newborns. Okay, it's very rapidly growing, and it's localized, non-ulcerated, expansile bony enlargement. Blue black areas of pigmentation is there, and it is so big that it leads to displacement of the upper lip. Okay, so another one of the most favorite question of examiners is adenomatoid odontogenic tumor. So what is important to know about this is it's painless and it's slow growing. Okay, swelling, so it's not the rapid one. So if something comes as slow growing enlarging swelling, you should think of AOT. Okay, and the most common site is anterior maxilla. You can see it in the picture. Okay, and in the radiograph again. All right, and it's often associated with the unerupted canine. It usually appears as a well-defined radiolucency. So the type of question which may come over here, they may ask is, they may have given you a question like, a patient comes to you and gives you this presentation, and on examination you find this particular site has that swelling, and this is the radiograph. So what do you diagnose? What do you think it is? Okay, so then, or there may be some direct question like, what is the most common site of AOT? They may give you four options: anterior maxilla, posterior maxilla, anterior mandible, posterior mandible, and then you will have to uh, get the correct answer. All right. Yeah. The next important tumor of oral cavity is pleomorphic adenoma. So this is one of the most common tumors of salivary gland. So because it's common, so it's more chances of it coming in the exam again. So these tumors, they appear as painless, firm, and mobile masses that rarely ulcerate the overlying skin. Okay, it's slow growing. Again, it's slow growing. Okay. How does it present extraorally? It is most often the tumor which is found in the parotid. So you can see the patient is having uh, the abnormal extraoral features which may be bothering the patient, but it's not giving him or her any pain. And intraorally, most often it occurs on the palate, followed by upper lip and buccal mucosa. Okay, so you should know about all these things. Questions, again, it may be the direct question, or they may give you a scenario, and then you will have to join all these puzzle pieces to reach to the diagnosis. So next one which we'll be talking about is mucoepidermoid carcinoma. So mucoepidermoid carcinoma is the most common malignant tumor of salivary gland. You should know this come as direct question. It's painless, slow-growing mass that is firm and hard, and it appears clinically as the mixed tumor. One is adenoid cystic carcinoma. It is most common malignant tumor of submandibular gland. Okay, again the direct question, which is the most common malignant tumor of submandibular gland? It is adenoid cystic carcinoma. You can have a look at the picture. This is the frenum of the tongue, and this is the floor of the mouth with a massive swelling there. Okay, so you may be given in the history that it presents as the firm unilobular mass in the gland. Okay, it is slowly growing. Patient comes to you and says that there is mass which is growing slowly on the floor of the mouth, left or the right side. Okay, and patient was not having any problem, but now he thinks that there is some numbness. Okay, so that includes the neural part as well, so there is perineural invasion has occurred. Okay, and if we look under the microscope, it gives us to the biopsy. In the biopsy section, it will give us Swiss cheese appearance. So adenoid cystic carcinoma, lot many, because it has very specific features. One is submandibular gland, another is the common site, one is the common site, another is the presentation, then inclusion of the nerve, and the how does it histopathologic section looks. So all these things are there. So if we just to summarize, these are the very important ones which I read at the end moment for my exam, but there are a lot many as well. So you should not leave anyone. I won't say that you should leave anyone to give a thorough read and thorough study to it, but I just wanted to give you the hint that what how you should be preparing for it. Okay, and you may get the direct question about any of the tumors, like their site, or how do they look, and how is their x-ray appearance, or is their appearance on the histopath or biopsy reports, and what age group does it affect. That may also give you quite a lot hints. And this is how you should start preparing for this is how you should prepare yourself for the exam, before the exam. Okay, I hope this was helpful. If you have found it helpful, uh, click the like button and show me appreciation, and you can comment for any further question or any other topic that you want me to make a video on.